people. I was going to talk a little bit today about preparing for a doctor visit. And specifically, I wanted to talk about your emotions and what my general advice would be about the emotional side of chronic illness. Now, as a disclaimer, I'm not a psychiatrist or a therapist. For my job, I'm not really designed to sort of treat and help manage, anxiety and sadness and stress related to illness. So what I wanted to talk about is how chronic conditions such as, say, fibromyalgia or migraine or chronic fatigue syndrome might become problems that themselves cause a lot of anxiety and a lot of problems in terms of being able to work, take care of your family, do things you want to do, and that can also cause you to become more anxious and depressed. It's interesting because some of disorders like the ones I've mentioned are also made worse by stress and anxiety. And so what you get is this vicious cycle where the disease itself makes you more stressed, and then the stress makes you more diseased. So my best advice would be, number one, to get data, to have data to show a physician, these are my symptoms and these are when I'm having them. It just keeps the conversation at a very concrete level, at least some of the time, so you can pass information back and forth. Kind of just keeps it sort of cold and clinical when we're really talking about trying to figure out your disorder. So using a calendar or symptom tracking app is a nice way to keep the emotional heat, the emotional volume down when we're really doing the hard work of trying to figure out what your body's doing. Second of all, it's good to get yourself some emotional support. So I love it when my patients come in and say, look, I have a lot of anxiety, and I think it's related to the fact that I never know what days I'm going to be able to work or take care of my children, but I have a therapist that I'm talking about it with, or my primary started me on some meds, and I think that they help in a lot of ways, but I'm still having these other physical symptoms. So having another person who's going to be able to support you in your emotional journey as a sick person is super, super important. Lastly, be open to the idea that there is this vicious cycle of these things interacting with each other, and understand that treating both the physical symptoms that you have and the emotional stress that they result in is very, very important. But like I said, using data to show your doctor what your symptoms are over the course of, say, a month helps him or her to be more of a detective, more of a bloodhound for sniffing out what your triggers may be and how to better keep those symptoms from interfering with your life. I hope this helps you get prepared for your visit, and I hope it helps you to get further along your journey toward feeling better.